My husband Paul and I have a son. His name is Hawken, and he's 19 years old today. But when he was 5 years old, he was diagnosed with Duchenne muscular dystrophy. We couldn't really find an organization that seemed to have the same sense of urgency that we did, and so we, never really intended to start a nonprofit. But just because we came across some what we felt were the most impactful research opportunities, we went ahead and formed a nonprofit organization called CureDuchenne. CureDuchenne is focused primarily on two aspects. One is research, and one is on care. CureDuchenne has been a leading funder of Duchenne research over the past 13 years. We funded PTC Therapeutics, Prosenza, which was later bought by BioMarin, and then Sarepta Therapeutics. All of these companies have gone into clinical trials for Duchenne muscular dystrophy, and two of them have been before the FDA. Actually, three of them have been before the FDA. And so our early funding has really been very impactful in getting these drugs to the point of being in first clinical trials and then FDA review. So I was obviously very disappointed with the outcome of Sarepta's advisory committee meeting. I think that there was ample evidence from the parents that showed that they really, really, really believe that this drug is working for their kids. I also understand the FDA's position is they are a data-driven organization, and they did not feel comfortable with the scope of the clinical trial that was conducted before. However, the head of the division that reviews this particular drug, Janet Woodcock, made it very clear to the advisory committee that they indeed should be considering the patient testimony and hearing what the parents have to say. So I think exon skipping does work. I think that it's a cornerstone of what is going to be a combination therapy that ultimately is going to be needed. I don't think there's any single drug that is going to cure this disease. And so CureDuchenne is really dedicated to looking at the whole disease and coming up with solutions. It's a little bit like a puzzle where there's a lot of different parts that have to fit well together. And so we're looking at the whole patient, the whole disease, and figuring out what are the different components that together will work as a cure. So my advice to families right now that have sons with Duchenne is, first of all, to not give up hope. When our son was diagnosed, there were a handful of drugs or a handful of research projects and no clinical trials at all. And now we have multiple clinical trials, and some of them are moving along quite nicely. We have to keep working at funding the research that is going to keep a development pipeline full, because in drug development, as you well know, most drugs don't work. And we have to be cognizant of that. And we have to not all hang our hats on one drug. When we, as a community, put all of our hope into one drug, we leave ourselves open for huge disappointment and setbacks. And so the more drugs we have in the pipeline, the more confident we can feel that we're going to have a solution and a cocktail of drugs for our boys.